Welcome. Take a deep breath and let it out slowly. You've arrived in a safe space, one that's gentle, quiet, and focused. Whether you're a nursing student, a practicing nurse, or someone working anywhere in healthcare, this moment is just for you. This is not a rushed lecture. There are no pop quizzes, no pages to flip through in panic. This is a calm, steady walk through one of the most important systems in the human body, the cardiovascular system. The heart, the blood, the vessels, they all work together in an elegant rhythm that sustains life. It's a system you'll meet every day in practice. Through each heartbeat you check, every blood pressure you monitor, every patient you comfort, whether you're just starting out in school, or you're deep into your nursing journey, or maybe you're coming off a long shift and just want something soft and meaningful to listen to, this video was made with you in mind. You can play this in the background while you study. Let the information sink in slowly. You don't have to write anything down unless you want to. You can lie down and close your eyes. You can sip your tea or gently review while drifting off to sleep. The pace is slow. The tone is soft. The goal is peace, because studying doesn't have to be stressful. And learning, especially in healthcare, should always be rooted in compassion, not just for patients, but for yourself. The cardiovascular system is more than facts and diagrams. It's a powerful, intelligent design that keeps blood moving, oxygen flowing, and life continuing. And every nurse, doctor, caregiver, and student who understands this system becomes better equipped to make a difference in someone's life. If today was a long day for you, or if you've been feeling overwhelmed by your workload or exams, please know this: you're doing enough. You're learning. You're growing. You showed up, and that matters. You are part of something bigger, a community of people who have chosen to care, who choose every day to carry knowledge, empathy, and skill into the world. And this video is one small way to support you on that path. So as we begin, let your body relax, let your mind soften, let your heartbeat remind you of the beauty and simplicity. Welcome to this quiet study session. Welcome to a peaceful journey through the heart and vessels. You are seen, you are valued, and you are not alone. Let's begin. The cardiovascular system is often called the circulatory system. It is one of the most vital systems in the body. Its main job: to move life itself. Imagine a constant, gentle current flowing, pulsing, never stopping. That's your cardiovascular system in action. It brings oxygen to your cells. It carries nutrients to where they're needed. It removes waste your body no longer needs. It keeps everything moving, every second, without pause. At its center is the heart, a strong, tireless muscle, roughly the size of your fist, but powerful enough to supply your entire body with blood. It beats around 100,000 times a day. Without asking, without needing thanks, the heart is divided into 4 chambers, 2 atria at the top and 2 ventricles at the bottom. Blood flows through these chambers in a specific pattern, moving from the body to the lungs and back again, rich with oxygen. It's a beautiful, silent dance. Surrounding the heart is a vast network of blood vessels. Some are large, like freeways. Others, tiny and delicate, like winding side streets. They carry blood to every corner of the body, to your brain, to your toes, to the smallest cell in the tip of your finger. There are 3 main types of vessels: Arteries carry blood away from the heart. Most of the time, it's oxygen-rich blood. Veins bring blood back to the heart, often low in oxygen, ready to be refreshed. Capillaries are the tiniest vessels. They connect arteries to veins and allow the actual exchange of gases and nutrients. Together, this system forms two main circuits. The pulmonary circulation takes deoxygenated blood from the heart to the lungs. There, it picks up oxygen and releases carbon dioxide. The systemic circulation takes that oxygenated blood and delivers it to the rest of the body. This flow is continuous. It never sleeps, even when you're resting, even when you're dreaming. Your cardiovascular system is faithfully at work, but it's more than biology. As a nurse or a medical student, understanding this system goes beyond diagrams. You'll assess it every day, listening for normal or abnormal heart sounds, feeling for strong or weak pulses, watching for signs of poor circulation, like cold extremities or swelling. Even checking capillary refill time gives you insight into how well the system is working. You don't have to memorize it all at once, tonight or today. Just let the pieces come together, one layer at a time. You'll start to recognize patterns, understand rhythms, and eventually you'll connect those dots in real life situations with real patients who need you. Let this be a soft entry point. No pressure, no expectations, just a steady unfolding of knowledge. The cardiovascular system is one of nature's most brilliant designs. It is precise, it is powerful, and now it's becoming part of your understanding too. As we move forward, we'll explore the heart in greater detail, its chambers, its valves, its beat. For now, just rest in the knowledge that you've taken the first step. You've opened the door, and that's how every journey begins. Let's begin at the center, at the place where everything starts. The heart, your body's most faithful muscle. It sits in your chest, tilted slightly to the left, tucked safely behind the sternum. Not too big, not too loud, but constant, powerful, beating over and over without needing to be told. The heart has four chambers: the right atrium, the right ventricle, the left atrium, the left ventricle. These chambers work in harmony, like a well-rehearsed team. Blood moves through them in a specific pattern, and each one has its role. Here's how it flows. Blood from the body, low in oxygen, enters the right atrium. From there, it's pushed into the right ventricle, which sends it to the lungs through the pulmonary artery. In the lungs, the blood picks up oxygen and releases carbon dioxide. It becomes bright red, full of life. Then it flows back to the heart, into the left atrium, and into the left ventricle, the strongest chamber. The left ventricle pumps that oxygen-rich blood out through the aorta, and it travels to the entire body. This full loop happens with every single heartbeat, over and over, without skipping a beat, to keep blood flowing in just one direction. The heart has valves: the tricuspid valve between the right atrium and right ventricle, the pulmonary valve leading to the lungs, the mitral valve between the left atrium and left ventricle, the aortic valve leading to the aorta. These valves open and close like tiny doors, letting blood through, then shutting to keep it from going backward. You can actually hear this happening with a stethoscope. Looked up, that's the sound of the valves working, a rhythm of life. Surrounding the heart are three layers: epicardium, The outer protective layer, myocardium, the thick muscular middle layer that contracts and pumps, endocardium, the smooth inner lining that keeps blood flowing cleanly. The myocardium is what makes the heart so strong. It works non-stop, day and night, your entire life. The heart is nourished by its own set of arteries, called the coronary arteries. They bring oxygenated blood to the heart muscle itself. If these arteries become blocked, it can lead to a heart attack because the muscle is starved of oxygen. This is why understanding coronary circulation is so important for nurses. As a nurse, you'll work closely with the heart. You'll listen to its sounds, measure how efficiently it pumps through things like ejection fraction or cardiac output. You'll watch for signs of stress, like chest pain, shortness of breath, or irregular rhythms. You'll also learn to recognize normal heart sounds versus murmurs, those extra or abnormal sounds that might indicate valve issues. But right now, you don't need to memorize every detail, just to let the pieces come together. The heart is more than a machine. It's a symbol of strength, of care, of continuity. And as a nurse, you'll bring your heart into every room you enter, not just physically, but emotionally, with presence, with compassion, with understanding. Tonight, as you listen, imagine the chambers opening and closing. Picture the valves guiding the flow. See the blood moving in loops, again and again. No rush, just quiet, steady movement. Your heart knows how to do its job, and you're learning how to care for it, in yourself and in others. Let's move next into the blood vessels, the highways and bridges that connect everything together. But before we do, take one more moment to feel that quiet rhythm in your own chest. It's always there, always working, and now you understand it just a little bit more. Now that we've explored the heart, the source of the rhythm, the engine of circulation, it's time to follow the paths it creates. Let's journey outward into the blood vessels. These vessels form a vast and intricate highway system, branching out from the heart to every part of the body, carrying blood to where it's needed, and bringing it back again when its job is done. There are three main types of blood vessels: arteries, veins, and capillaries. Each one has a different role. Each one is built for a purpose. Let's take them one at a time. Arteries, the highways of pressure. Arteries are strong and muscular. They carry blood away from the heart. Most of the time, this blood is rich in oxygen, bright red, full of energy and nutrients. Because arteries carry blood that has just been pushed out of the heart, they must be able to handle high pressure. Their walls are thick and elastic, able to expand and contract as the heart beats. The largest artery in the body is the aorta. It leaves the left ventricle of the heart, arches upward, and then curves down through the chest and abdomen, branching out into smaller and smaller arteries as it goes. As arteries move away from the heart, they branch into smaller vessels called arterioles. These arterioles then narrow into the tiniest vessels, the capillaries. Capillaries, the exchange stations. Capillaries are where the magic happens. They are the smallest blood vessels, so small that red blood cells pass through in single file. Their walls are only 1 cell thick, which allows for easy exchange of materials. In the capillaries, oxygen leaves the blood and enters the tissues. At the same time, carbon dioxide and waste products move from the tissues into the blood. Nutrients are delivered. Hormones are passed along, cells are nourished, and then the blood continues its journey. After this exchange, the blood is now low in oxygen. It begins its return trip to the heart. Veins. The gentle return. Veins carry blood back to the heart. This blood is usually darker, lower in oxygen, and ready to be recharged by the lungs. Veins don't experience the same high pressure that arteries do. Instead, they rely on other mechanisms to move blood. One-way valves inside the veins prevent blood from flowing backward. Skeletal muscles help push blood forward. As you move, breathing creates changes in pressure that help draw blood toward the chest. The largest veins in the body are the superior and inferior vena cava. These return blood from the body back to the right atrium of the heart. Just like arteries branch into arterioles, veins are formed by small venules that collect blood from the capillaries. These venules combine into larger veins as they approach the heart. Layers of vessel walls, all blood vessels, except for the capillaries, share the same basic wall structure. 3 layers. Tunica intima, the smooth inner lining, made of a thin layer of endothelial cells. Tunica media, the middle layer, made of muscle and elastic tissue. This layer is thickest in arteries. Tunica externa, or adventitia, the outer layer, made of connective tissue to protect and support the vessel. Understanding these layers helps explain how diseases like atherosclerosis develop. When plaque builds up in the inner lining and narrows the vessel, reducing blood flow and increasing the risk of heart attacks or strokes. Vital signs and vessels. As a nurse, you'll assess the cardiovascular system every shift. Checking the pulse gives you insight into how well blood is flowing. Measuring blood pressure tells you about the force of blood inside the arteries. A healthy blood pressure is typically around L, but this varies with age, activity, and underlying conditions. Hypertension or high blood pressure can put strain on arteries over time, causing damage that may lead to serious cardiovascular problems. You'll also check for perfusion, how well blood is reaching tissues. Are the fingers and toes warm? Is the capillary refill time under 2 seconds? Is there any swelling, which might suggest poor venous return? These simple assessments give powerful clues about how well the vessels are doing their job. A gentle flow. When you think of the vascular system, imagine a vast, flowing river system. The arteries rushing out like strong streams, the capillaries like gentle creeks where life is exchanged, and the veins as peaceful, winding paths, bringing blood home. There is balance in this design. There is wisdom in every branch, every valve, every curve. As you continue your nursing journey, you'll understand more deeply how these vessels respond to illness, to injury, and to healing. But for now, rest in the beauty of how it all connects, how the heart and vessels work in perfect harmony to carry life throughout the body. Next, we'll explore the blood itself, the vibrant fluid that makes this entire system possible. But first, take a deep breath, let your mind relax, and feel gratitude for the silent work happening inside you every moment of every day. We've walked through the heart, followed the vessels, and now we arrive at what flows within them. The quiet river of life, blood. It may seem simple at first glance, just red liquid moving through the body, but blood is far more than that. It is a living tissue, a carrier of breath, nutrition, immunity, warmth, and waste. Every drop contains a story, and every nurse who understands it holds a powerful key to healing. Let's begin with what blood is made of. The composition of blood. Blood is composed of plasma and formed elements. Each plays a vital role. Plasma. Plasma is the pale straw-colored liquid that makes up about 55% of blood. It's mostly water, around 90%, but it also contains proteins, electrolytes, hormones, nutrients, and waste products. Three important plasma proteins include albumin, helps maintain fluid balance by keeping water inside blood vessels. Globulins, involved in immunity and transporting substances. Fibrinogen, plays a key role in clotting. Plasma is the transport medium, the gentle stream that carries substances to and from cells, organs, and tissues. Formed elements. These are the cells and cell fragments suspended in the plasma. They make up about 45% of total blood volume and include red blood cells, erythrocytes. These give blood its red color. They carry oxygen from the lungs to the body and carbon dioxide back to the lungs for removal. They're packed with hemoglobin, a protein that binds oxygen. Each red blood cell lives about 120 days before being recycled by the spleen and liver. White blood cells, leukocytes. These are the body's defenders. They fight infection, respond to inflammation, and help with healing. There are different types, including neutrophils, lymphocytes, monocytes, eosinophils, and basophils, each with a unique role in immunity. Platelets, thrombocytes. Platelets are small fragments that help blood to clot. When there's an injury, platelets gather at the site and form a plug, working with clotting proteins to stop bleeding. Without them, even minor injuries could become dangerous. Functions of blood. Blood is not only about movement, it's about connection. It links every system in the body. Here's what blood does. Transports oxygen, nutrients, and hormones. Removes waste like carbon dioxide and urea. Regulates body temperature. Maintains pH and fluid balance. Defends against infection and disease. Clots to prevent blood loss. As a nurse, you'll often check blood values to understand a patient's health. Tests like hemoglobin and hematocrit measure oxygen carrying capacity and blood volume. White blood cell count reveals signs of infection or immune issues. Platelet count shows if clotting ability is normal or impaired. Electrolytes and glucose tell you about hydration, energy, and organ function. These numbers aren't just data, they're insights into what's happening beneath the surface. Blood types and compatibility. Not all blood is the same. People have different blood types based on antigens found on red blood cells. The main system is the ABO blood group, combined with the Rh factor. Type A has A antigens. Type B has B antigen. Type AB has both. Type O has none. The Rh factor is either positive, on, or negative. So, someone might be a plus, O, B plus, and so on. Why does this matter? Because in transfusions, giving the wrong blood type can cause a dangerous reaction. That's why type matching is a critical part of nursing care, especially in emergencies. Type O is the universal donor. Type AB plus is the universal recipient. Blood circulation. A journey. Now imagine the path of a single drop of blood. It begins in the right atrium, low in oxygen. It's sent to the lungs, where it releases carbon dioxide and picks up oxygen. Then it flows to the left atrium, down to the left ventricle, and is pumped into the body. It travels to the brain, to the fingertips, to the liver and kidneys, nourishing, warming, cleaning. Then it returns, low in oxygen, ready to start again. This cycle is constant, endless, vital, even while you sleep, even while you listen now. Millions of blood cells are on their journey, delivering life in silence. Your role as a nurse, your hands will draw blood. Your eyes will watch the color and the flow. Your heart will interpret the lab values and assess what they mean. You'll be there during transfusions, during infections, during moments of bleeding and healing. You'll explain to families what hemoglobin means. You'll check for bruising, bleeding gums, pale skin. You'll administer fluids, iron, antibiotics, or platelets. Each task carrying profound meaning beneath the surface. And so, by understanding the blood, you're understanding more than biology. You're learning to see what's happening with quietly, constantly, invisibly. Next, we'll explore how the heart creates its own rhythm. The cardiac conduction system, the electrical pattern that keeps the beats steady and strong. But for now, take a moment, feel your own pulse. That gentle tapping, that's your blood, that's life. And now you understand it just a little more. Let's return to the heart, not to its muscles or valves. This time, but to something even more subtle, its electrical rhythm. The heart does not wait for outside instruction. It doesn't need reminders to beat. It holds its own internal conductor, a system of silent signals that tells it when to contract, how fast to go, and when to rest between beats. This is the cardiac conduction system, the heart's built-in wiring, and understanding it will help you recognize the rhythms of life and the signs of when something might be wrong. The heart's natural pacemaker, the SA node. It all begins in a small group of cells in the right atrium, near where the superior vena cava enters the heart. This is the sinoatrial node, or SA node. This little cluster is the natural pacemaker of the heart. It generates electrical impulses, tiny waves of energy, around 60 to 100 times per minute in a resting adult. Each impulse spreads across the atria, causing the atria to contract. This pushes blood into the ventricles. At the same time, the impulse travels toward the next key structure, AV node. The gatekeeper. The impulse reaches the atrioventricular node, or AV node. This is located at the junction between the atria and the ventricles. The AV node pauses the signal, just for a moment. This delay is important. It gives the ventricles time to fill with blood before they contract. Without this pause, the rhythm would be too fast, too uncoordinated. Once the signal passes through the AV node, it moves quickly down into the bundle of His and Purkinje fibers. The bundle of His splits into two branches, the right bundle branch and the left bundle branch, which run along the walls of the heart's ventricles. From there, the impulse travels into tiny fibers called the Purkinje fibers. These fibers carry the signal to the ventricular muscle cells, causing the ventricles to contract from the bottom up, efficiently pushing blood out of the heart. And then, the cycle begins again, over and over, a perfect loop. a quiet rhythm you can hear through a stethoscope or see on an electrocardiogram. The ECG, reading the heart's language. The electrical activity of the heart can be seen with an ECG or EKG. This test records the electrical signals as waves. Here are the main parts. P wave, atrial depolarization. When the atria contract, PUR is complex ventricular depolarization. When the ventricles contract, T wave, ventricular repolarization. When the ventricles reset for the next beat. As a nurse, you may not need to interpret full ECG strips at first, but knowing what these waves represent helps you recognize patterns and irregularities. For example, a fast rhythm might suggest tachycardia. A slow rhythm might be bradycardia. Missing or irregular waves might suggest arrhythmias like atrial fibrillation or heart blocks. The nervous system and the heart. The heart's rhythm is automatic, but it is also influenced by the autonomic nervous system. The sympathetic nervous system speeds the heart up. It kicks in during stress, excitement, or physical activity. It raises your heart rate and increases the force of contraction. The parasympathetic nervous system, mainly through the vagus nerve, slows the heart down. It dominates during rest, sleep, and relaxation, bringing a sense of calm. This balance helps your heart respond to your needs in every moment. Whether you're running, resting, laughing, or sleeping, the heart adjusts accordingly. Why this matters in nursing. As a nurse, understanding the conduction system helps you care for patients with arrhythmias, heart block, atrial fibrillation, pacemakers or defibrillators, cardiac arrest. You'll check for pulse regularity. You'll listen for skipped beats. You'll monitor telemetry. You'll respond when rhythms go from normal to dangerous. And you'll be there in critical moments, knowing that rhythm is more than just numbers on a screen. It's life expressed in a pattern, a quiet appreciation. So now, as you rest and listen, imagine that quiet spark of energy, starting in the SA node, spreading through the heart like a gentle ripple, coordinating a beautiful, constant beat. This is happening in you right now, and it's happening in the people you'll care for. The heart knows how to keep its time, and now you know how to read its rhythm. In our next section, we'll talk about some of the most common cardiovascular conditions, what they are, how they affect the system, and what nurses need to know. But for now, take one deep breath, feel your own pulse, steady and calm, and remember, you are learning the language of life itself. Now that you understand how the heart works, how the blood flows, and how each beat is guided by an internal rhythm, it's time to talk about what happens when something goes wrong. As nurses, we see the effects of cardiovascular disease every day. Chest pain, shortness of breath, swelling in the legs, abnormal rhythms. These signs often point to underlying issues in the heart or blood vessels, but knowing the why behind them brings clarity and helps us provide care with knowledge and confidence. Let's gently explore some of the most common cardiovascular conditions. Hypertension, the silent pressure. Hypertension or high blood pressure is sometimes called the silent killer. Why? Because it often has no symptoms, yet over time it damages the arteries, makes the heart work harder, and increases the risk of heart attack, stroke, and kidney damage. Blood pressure is the force of blood pushing against artery walls. Normal is around 20 High blood pressure is generally 140/90 or above, though new guidelines are stricter. Risk factors include stress, poor diet, especially high salt, obesity, smoking, lack of physical activity, genetics. As a nurse, you'll often be the one to check blood pressure regularly. You'll teach patients how to manage it through medication, diet changes, exercise, stress reduction. Even small lifestyle changes can make a big difference. 2. Coronary artery disease. The heart needs blood too, and it gets its own supply through the coronary arteries. In coronary artery disease, these vessels become narrowed or blocked, usually by plaque, a buildup of cholesterol and fats. This reduces blood flow to the heart muscle. If the blood flow becomes too limited, the person may experience chest pain called angina. If the blood supply is completely blocked, it causes a heart attack or myocardial infarction, MI. Symptoms of a heart attack may include chest pain or pressure, pain radiating to the arm, jaw, or back, nausea, sweating, shortness of breath, feeling faint. As a nurse, your role may include monitoring ECG changes, administering oxygen or medications, preparing for cardiac catheterization, offering emotional support to patients and families. Prevention is key. Healthy eating, exercise, managing cholesterol, and quitting smoking. 3. Heart failure. When the pump weakens, heart failure means the heart is no longer pumping blood effectively. It doesn't mean the heart has stopped, but it is failing to meet the body's needs. There are two main types. Left-sided heart failure. Blood backs up into the lungs, causing shortness of breath, fatigue, and coughing. Right-sided heart failure. Blood backs up into the body, causing swelling in the legs, feet, or abdomen. You may hear terms like systolic failure. The heart can't pump well. Diastolic failure. The heart can't relax and fill properly. Common signs and symptoms. Shortness of breath, especially when lying down. Swelling, edema in the legs or ankles. Weight gain from fluid retention. Fatigue. Rapid heartbeat. Nursing care may involve monitoring daily weights, administering diuretics, teaching patients about fluid and salt restrictions, encouraging medication adherence. Heart failure is chronic, but it can be managed with proper care and support. 4. Arrhythmias. The heart has a rhythm, like a song, but sometimes that rhythm becomes irregular. These are called arrhythmias, abnormal heartbeats. Some are harmless, others are life-threatening. Types include tachycardia, heart rate too fast, bradycardia, heart rate too slow, atrial fibrillation, AFib, rapid, irregular beats from the atria, ventricular fibrillation, chaotic activity in the ventricles, requiring immediate defibrillation. As a nurse, you may monitor heart rhythms, check vital signs and oxygen levels, administer medications like beta blockers or antiarrhythmics, prepare for or assist with procedures like cardioversion or pacemaker insertion. Recognizing irregular pulses and ECG patterns early can save lives. 5. Peripheral vascular disease. This condition affects the vessels outside the heart, especially in the legs. It's caused by narrowing of the arteries, often from the same plaques seen in coronary artery disease. Symptoms include leg pain with walking, called claudication, cold feet, weak pulses in the legs, skin discoloration or wounds that heal slowly. Nurses help by assessing circulation, teaching foot care, and encouraging walking to improve circulation. Compassionate knowledge, yeah, each of these conditions involves the cardiovascular system in different ways. But as a nurse, your response is always the same: observe, listen, act, educate, support. Your care makes a difference, not just with medications or vitals, but with your presence, your reassurance, your ability to explain what's happening in a way that brings peace. As we move into the next section, we'll talk about how you assess the cardiovascular system, what to look for, what to listen for, and how to make sense of it all. But for now, take a moment. Remember that with every heartbeat you learn about, you become more prepared to protect the hearts of others. You are learning not just how the body works, but how to care for it with grace. Now that you understand the heart, the vessels, and the blood that flows through them, let's talk about what you'll actually do as a nurse. Cardiovascular assessment is one of the most important skills in nursing. You'll use it every shift with almost every patient. It's how you check the health of the heart and circulatory system. It's how you listen for signs of distress. It's how you catch early warnings before they become emergencies. But don't worry, this doesn't have to be complicated. You already know more than you think. Let's walk through it step by step, calmly, clearly, and gently. Start with the basics: inspection and history. Begin by looking at your patient. Observe their color. Are they pale, flushed, bluish around the lips or fingertips, called cyanosis? Look at their breathing. Is it calm, labored, fast, or shallow? Are their legs or ankles swollen? That could be edema, a sign of fluid buildup from heart failure or poor circulation. Then ask gentle, open questions. Have you been feeling tired lately? Any chest discomfort or tightness? Have you noticed swelling in your feet? Do you ever feel short of breath when lying down or walking? These answers can give you valuable insight even before you touch your stethoscope. Vital signs. Listening to the body. Check and record vital signs. Heart rate. Is it within normal range? Regular or irregular? Blood pressure. High, low, or both arms equal? Respiratory rate. Are they breathing comfortably? Oxygen saturation. Is their blood well oxygenated? These numbers paint a picture, and over time, you'll learn how to recognize when something's not quite right, even before it shows up on a screen. Palpation, feeling the flow. Next, use your hands to feel for pulses. Start with the radial pulse at the wrist. Then, depending on the patient's condition, you may check brachial pulse, inner arm, carotid pulse, neck, dorsalis pedis and posterior tibial pulses, feet and ankles. You're checking rate, rhythm, and strength. Is the pulse strong and steady, or faint and thready? If a pulse is hard to find, it may indicate poor circulation. Compare both sides of the body to see if there's a difference. You can also check capillary refill. Press on the nail bed, then release. The pink color should return within 2 seconds. Longer than that, it could signal poor perfusion. Auscultation, listening to the heart. Now gently place your stethoscope on the chest. Listen for heart sounds in four main areas: aortic area, right second intercostal space; pulmonic area, left second intercostal space; tricuspid area, lower left sternal border; mitral apical area, left fifth intercostal space; midclavicular line. You'll hear the familiar loop-dub sound. That's the closing of valves. First the AV valves, tricuspid and mitral, then the semilunar valves, aortic and pulmonic. Listen for rate. How fast is the heartbeat? Rhythm. Is it regular or irregular? Extra sounds, murmurs, clicks, or gallops. Take your time. The more you listen, the more you'll understand. Heart sounds may seem complex at first, but over time, your ears will grow wise. Other signs to watch for. Be aware of other signs that may indicate cardiovascular issues: jugular vein distension, visible bulging of the neck veins, often from fluid overload; cool extremities, a sign of poor circulation; crackles in the lungs, may suggest heart failure causing fluid buildup; rapid weight gain, fluid retention is a common sign of decompensated heart failure. Always look at the whole picture, not just one number or one sound. The body speaks in patterns. The nurse's intuition. Cardiovascular assessment isn't just about tools. It's about presence. It's about learning to notice, to ask the right questions, to connect what you see, feel, and hear. And with each patient you meet, your confidence will grow. You'll learn to trust your hands, your ears, and your instincts. You'll be the one who notices the change in a patient's color, who catches a drop in blood pressure before it becomes a crisis, who listens to a worried family member and takes action. You are learning a skill that saves lives, quietly, gently, skillfully. You've made it to the end of this journey, and what a quiet, meaningful journey it has been. We began with a welcome, an invitation to slow down, to let the mind soften and the heart open. Together, we explored the beautiful and complex system that keeps the body alive, the cardiovascular system. From the steady beat of the heart to the winding paths of the vessels, to the living river of blood, to the electric spark that gives it rhythm, you've gently absorbed knowledge, layer by layer, with care, curiosity, and calm. Let's take a moment to breathe that in. You've learned about the structure of the heart, its chambers, its valves, its walls, and how it pumps tirelessly, not just for days or months, but for decades, without rest. You followed the blood vessels, arteries, veins, and capillaries, each with their unique function, each with their vital role in delivering life to every cell. You explored the blood itself, its components, its power to carry oxygen, to defend the body, to heal, to connect every part of us from head to toe. You learned how the heart creates its own rhythm, how it speaks through electrical signals, through waves and patterns you can hear, see, and one day trust with confidence. You walked through common conditions like hypertension, heart failure, arrhythmias, and coronary artery disease, not just as facts or terms, but as real experiences you'll encounter in practice. You now understand what's behind the symptoms and what it means to respond with both skill and compassion. You even practiced seeing through a nurse's eyes, observing, listening, touching, and interpreting the signs that a patient's cardiovascular system is speaking. You've begun to think like a nurse, And all of this gently, without pressure, without needing to prove anything, just steady learning at your own pace. If you're feeling tired, that's okay. If you didn't catch every word, that's okay too. You showed up, you listened, and that's enough for today. Remember, nursing is not about perfection. It's about presence. It's about continuing to learn, to notice, to care. You are building something powerful inside yourself, a mind that understands, and a heart that cares deeply. Whether you're a student just beginning, a nurse returning to review, or someone simply drawn to this incredible field, please know this. You are part of something meaningful. The work you are preparing for matters. Your effort matters. And your well-being matters too. So tonight or today, let this video close with a sense of peace. You've planted the seeds of knowledge, and with time, with patience, they will grow. May your heart feel light. May your mind feel calm. And may your spirit feel encouraged, knowing you're one step closer to becoming the nurse you are meant to be. You are not alone on this journey. We're walking it together, one beat at a time. Thank you for being here.